Welcome to 15 Minutes. I'm Dean Cox. Tonight we will delve deep into the interactions between paramedics and sufferers of schizophrenia. Schizophrenia is a multifaceted psychiatric disorder involving abnormal social behaviour such as delusions, hallucinations, disorganised speech, and thoughts. The most complex and debilitating mental conditions seen by paramedics today. The World Health Organization has ranked schizophrenia as one of the top 10 illnesses contributing to the global burden of disease. It affects the normal functioning of the brain, interfering with a person's ability to think, feel, and act. It is classified as a syndrome with symptoms that are usually categorized into positive symptoms, negative symptoms, and cognitive impairments. In today's episode, we are going to discuss paramedics and their interactions with the schizophrenic consumer. So now we're joined by Dr. Emily, a psychiatrist and an expert in schizophrenia. Dr. Emily, I understand that schizophrenia is divided up into positive symptoms, negative symptoms, and what else is it divided?
Disorganised symptoms.
Disorganised
That's
symptoms,
it.
I see.
So your positive symptoms,
Mm-hmm.
they consist of your hallucinations and your delusions.
Mm-hmm.
You've also got your negative symptoms, so they consist of anhedonia, which is actually the inability to feel pleasure in normally pleasurable experiences.
Okay.
You've also got emotional flattening in that one, and poverty of speech, asociality, and apathy.
I see.
In the disorganised symptoms, you've got bizarre behaviour and disorganised speech. Well, bizarre behaviour can come in two different types. You've got catatonia and catatonic stupor.
Okay.
So you've got catatonia, which is complete absence from the world. So they might pause and just not be in touch with reality. So, for example, if I sat here and didn't do anything like that.
That was disorientating.
It is. You've also got catatonic stupor,
Mm-hmm.
and that's where someone can assume an abnormal or weird position for extended periods of time.
Mm-hmm. Okay.
Yeah, I'm sure it would be uncomfortable.
Yeah. So what is disorganised speech?
Disorganised speech is where the affected person fails to make sense despite committing to semantic rules and stuff like that.
Okay.
They just incomprehensible, don't understand it. Their words make sense, but the person receiving the information can't actually understand it. It's like me saying, orange banana, how are you? Morning.
Goodness me. Well, that would be hard to understand.
Yeah.
Tell me a little bit about delusions.
Delusions are an erroneous belief that is fixed and firmly held despite contradictory evidence.
Okay.
So a patient believes that someone might be following them, or they have this idea that they have this mission to do,
Okay.
but clear contradictory evidence suggests otherwise.
Oh, I see.
Yeah. Not all people that suffer delusions have schizophrenia, but it has been shown that patients that do have schizophrenia, 90% of them will have delusions.
I see. Hallucinations?
Well, hallucinations are a sensory experience that seems real to the person having it, but it occurs in the absence of any external stimuli.
Okay.
So, for example, a lot of schizophrenic patients actually have auditory hallucinations, occurs in 75% of them.
Okay.
Even deaf patients that have had schizophrenia have been known to have auditory hallucinations.
I see.
They've also found, scientific-wise, that hallucinations in auditory format actually aren't people hearing voices, but rather than misinterpreting thought processes. So it means that they might hear something, but that isn't actually someone else. It's actually their own thoughts in their head, but it's heard in a different format.
Thank you very much for your time.
No worries, my pleasure.
So now we cut to Constable Esther Cooper with Victoria Police to give us an insight into the risks associated with pre-hospital emergency care for schizophrenic consumers.
Thanks, Dean. In reference to paramedics' dealings with people with schizophrenia, it's important that we have a fundamental awareness of the condition. This ensures the safety of both the paramedic and the person dealing with schizophrenia. Having a greater understanding allows sufferers to feel more comfortable using healthcare services. This is likely to lower the risk of preventable illnesses, self-harm and suicide. It also helps to create positive relationships and experiences which diminishes the risk of worsening of conditions because we don't have that lack of treatment. It's also important to note that due to the presentation of this illness, that paramedics be honest and transparent with their actions. This fosters trust and minimises risk. It may be important to make accommodations for the person to make them feel more comfortable. This can be done through getting a family member or bystander to come in the ambulance with them. Just makes the experience more positive. In all other instances, violent behaviour should not be assumed with a person with schizophrenia. They are no more likely to be violent than any other person in the population. Working off this assumption can inhibit rapport and trust building. It's also a deficit to their confidence and self-esteem, so try to remember that.
So now we cross to a short presentation by Carly, a paramedic with Ambulance Victoria, discussing their interventions.
What happens when a paramedic gets called to a consumer with schizophrenia?
So when it comes to potential paramedic intervention of schizophrenia, we basically start from the least invasive, moving to a more restrictive approach if the situation escalates. We basically want to be going through a thorough clinical approach, including mental status assessment, and that allows the paramedic to create a whole picture of the patient's behaviour in accordance with their current mental function, and it allows the paramedic to use their clinical judgment and their decision making to make an action plan. Within Victoria, the Mental Health Act puts emphasis on mental health patients of having their own autonomy over their healthcare decisions, their treatment and their care, so we want to try and get them as involved as they possibly can be. The ideal situation is a simple transportation without restraints, without any drug administration, and we want to be taking them to a mental health facility. So it doesn't necessarily have to be the emergency department, it can also be the public health services, a denominational hospital, a privately owned operated hospital, or a private health facility.
I'm sure there are cases where a schizophrenic person is not very open to help. What happens if the situation escalates?
So there may be a situation where the patient is medically compromised, they're dangerous to themselves and to others, including the paramedics, and they're refusing their medical care and transportation. In the Mental Health Act, the paramedics themselves have the authority. They can detain, restrain, search and sedate a behavioural disturbed patient who require involuntary emergency medical assistance. It may include the use of reasonable force and mechanical restraints. But as long as all other reasonable and less restrictive options have been tried or considered and they've been found undesirable.
Why was Ambulance Victoria given these powers?
So the power was given with the recognition that paramedics have a key role in providing pre-hospital mental health care. The inclusion of the provisions also aimed at reducing the amount of mental health patients, including schizophrenics, from being handcuffed and transported to hospital by the police.
We now cross over live to Dr. Sam, a schizophrenia specialist, to discuss treatment options for the schizophrenic patient. Unfortunately, she couldn't make it to the studio today, so we cross to her now via Skype. So Dr. Sam, my first question to you is, how is the schizophrenic patient treated?
In regards to the treatment and management of schizophrenia, a multidisciplinary approach, including medication, psychological treatment, and social support, is definitely the most effective.
What are the pharmacological treatment options for schizophrenia?
Antipsychotic agents are our first line of treatment for schizophrenia. Common drugs used by those affected by schizophrenia are chlorpromazine, risperidone, clozapine, and lorazepam, just to name a few. These drugs are able to treat some of the symptoms of schizophrenia, however they are unfortunately associated with a number of adverse effects.
So what are these adverse effects?
These adverse effects include, but are not limited to, the development of neuroleptic malignant syndrome, tardive dyskinesia, and myocarditis.
I would be reluctant to take these sorts of medications. Are there any adherence
Adherence issues to medications do often occur due to a number of reasons. Some of these drugs can be very costly for the patient, and they can range anywhere from $5 to $2,000 per month. Also, many patients are unable to tolerate the side effects such as anxiety, insomnia, drowsiness, and weight gain, which results in them discontinuing their prescribed medications. Antipsychotic medications also require a period of time before the emergence of clinical efficiency, which also causes people to cease taking their medications.
Are there any non-pharmacological treatment options?
Also rely on psychosocial therapy, which enables them to develop coping strategies and social skills. Family is also very beneficial for those with schizophrenia, as it provides a network of support. A recent study has found that psychosocial therapy combined with pharmacological treatment improves treatment adherence and reduces the amount of hospital admissions. Therefore, it is imperative that we provide these patients with the required care in order to improve their quality of life.
Sam, thank you for your time. Now we're going to talk to Eliza, a mental health nurse, about the ongoing management of schizophrenia. Hi, Eliza.
Hi, Dean. How are you today?
Very good. Nice to meet you. So, Eliza, how is schizophrenia managed?
Look, it's most important to point out that schizophrenia is a complex disease, and as is its management. There are a few different treatments that can be used compared to antipsychotics, which I'm sure Dr. Sam talked to you about earlier.
So what are these therapies?
So one therapy is adjunctive therapy. That's basically used for the patient with schizophrenia who also has things like depression or anxiety. And for those people, they also need medications for those conditions.
So what is electroconvulsive therapy?
I'm glad you asked, Dean, and I've actually got a quite good definition down pat here. So it's a carefully controlled electrical current that passes through the brain, and it affects the electrical brain activity.
Okay.
And its aim is to produce an improvement in those psychotic symptoms.
Okay. So what are some non-pharmacological treatments?
So one option is psychological treatment, and that can be individually or group-based. And it revolves around a combination of support and education. The treatment should be aimed to address certain issues within a schizophrenic patient, such as their functioning, and to improve issues such as medication compliance. Involving family with a schizophrenic patient is also really important as a treatment. They can help provide support, they can be educated about what schizophrenia really is, and they can also help with crisis intervention, and they can provide problem-solving training. I guess the most important thing revolving treatment for a schizophrenic patient is finding the balance between what treatments work for the individual patient and just making sure that that balance works for the patient, for the family, and for everyone else involved in the situation.
We're now going to see a reenactment of a handover and a discussion of communication strategies.
When giving handovers to hospital staff and other medical officers, it's important to go by the "I'm Miss Danbo" mnemonic. This involves identification of the patient by their name and including a date of birth, the medical complaint, whether that be mental health and what kind of mental condition, injuries sustained, injuries that could be sustained due to the condition such as self-harm, signs and symptoms including how the condition may be presenting, and treatment. This includes use of restraint or sedatives by paramedics and when they were given. Any allergies the patient may have, including medications or other substances and their reactions, medications they're on, when they were prescribed them, how often they take them, if they've been taking them regularly, and why they were prescribed them, background information, including when the condition was diagnosed, where they've been treated previously, and how it may present, and other information including contact details of a relative. Here are some tips for effective communication. Stand close to the consumer, but be sure not to intrude on their personal space. Express interest and concern. Speak in a positive tone, clearly, and convey calmness in your tone as not to alarm the consumer. Let the consumer talk. Try not to interrupt or cut them off. Be an active listener. This may involve head nods, eye contact with the speaker, rebutting what was said, or asking clarifying questions. Keep questions direct and to the point. Use simple language, demonstrate an understanding, and provide rest and reassurance as you would any other patient. Using a steady, neutral, calming tone of voice can be reassuring to someone who is troubled by their own thoughts. It's important not to argue with someone who has delusions. You can't change them, but acknowledge the effect they have.
Typical mental status assessment findings relevant to paramedics include appearance. Schizophrenics may look like they have a lack of hygiene and often can look a bit dishevelled. Behaviour. Their behaviour is often bizarre, and if you talk to their family members, they may say that their behaviour is so bizarre that they aren't who they used to be. Speech. Their speech can be lots or little, and sometimes inappropriate. Often in catatonic episodes, there is no speech at all. Mood. Their mood can range between excited, depressed, agitated, or irritable. They are often agitated, though, because of the other symptoms that are seen. Response can be flat or apathetic. Perceptions. They often experience hallucinations, particularly of auditory format. Thought content. Schizophrenics often experience delusions or false beliefs. Thought flow. Their thought flow is often erratic and concentrations. They often have a poor ability to organise thoughts, impaired judgment, and sometimes a lack of insight.
So that's our program for tonight. We've covered what schizophrenia is, how it's treated, and its relevance to paramedic practice. If you have any questions, don't hesitate to contact us at deansmailbag@15minutes.com.au. I'm Dean Cox. Thank you and good night.
Go.
So now we're joined. I'll try again.
Adherence issues to medications do often occur due to...
So we now cross over to Dr. Sam, a schizophrenic specialist, to discuss treatment options for the schizophrenic patient.
You called me schizophrenic. More... what's the word?
No wonder people